My presentation today is about health promotion, models, practice, and impact on public health, a critical examination of health promotion models and applied initiative and, and the contribution of the delivering organization to public health. This presentation covers models of health promotion, the health promotion initiative, improving public health, the health belief models focuses on belief, risk, management, barriers, and self-efficacy. Beatty's model combines individual behavior change with community policy action. Evaluation. Human belief models is useful for individual change, while Beatty's models addresses wider social factors. Health Promotion Initiative. Launched in 2020 to tackle overweight and obesity, it aims to promote healthier lifestyle, reduce obesity-related disease. Actions: healthy eating, physical activity, calorie awareness, and NHS weight loss support. It impacts increased engagement and a short-term behavior change, but no clear population level reduction in obesity. Improving public health. The Office for Health and Improvement and the Office for Health Improvement and Disparities, the OHID, provide health surveillance, evidence, policy, policy support, and partnership leadership. It addresses health inequalities and supports prevention. Limitation. The impact is affected by social determinants, funding constraints, and commercial influences. Model of health promotion. Current models of health promotions include medical preventative model, focuses on reducing mobility, sorry, excuse me, morbidity, and premature death through clinical intervention. Beatty's models promotion considers four approaches: health persuasion, legislative action, personal counseling, and community development. Health belief model focuses on how an individual believes about disease risk, benefits, barriers, and self-efficacy influence health behavior. Social cognitive theory emphasizes the interaction between individual behavior, environment, and social influences, including observational learning and self-efficacy. Beatty's models of promotion considered four approaches: pursuance, legislative action, counseling, and community development. Social ecological model recognizes the health behavior is influenced by multiple levels, including the behavior, the individuals, family, social network, organization, communities, and wider policy environment. Solatogenic model focuses on factors that create and maintain health rather than concentrating primarily on disease and risk factors. It emphasizes resources and a person's sense of coherence. Comparing two models, health belief model versus Beatty's model. The health belief model, Baker 1974, level of focus, individual cognition and behavior. Core idea, behavior change depends on perceived susceptibility, severity, benefits, barriers, and self-efficacy. Driver of change, individual rational decision making. Typical use, screening updates, smoking cessation, vaccination behavior. Beatty's model, level of focus, individual and collective, authoritative and negotiated approaches. Core idea, a 2 to 2 matrix, crossing mode of intervention, authoritative versus negotiated, in bracket, with focus, individual versus collective, in bracket. Driver of change, combination of policy, community development, and perception. Typical use, legislation, community, empowerment, health education, personal counseling. Side-by-side comparison. Decision, theoretical roots, health belief model, sociology, social psychology, cognitive history. Beatrice model, sociology and political theory. Unit of analysis, the individuals. Beatrice model, individual and the collective community. View of the client, rational actor weighing cost and benefit. Beatrice model, actor shaped by social structure and power. Strengths, simple, predictive, easy to operationalize. Beatrice model addresses root cause and inequalities. Limitation, ignores social, economic, and environmental context. Beatrice models, more complex to apply, harder to measure outcomes. Evaluating effectiveness of both models. Where these models are effective. The HBM is effective for short-term, single behavior change, example, bowel cancer screening update, where individuals already have access and agency. Beatty's model is effective at directing practitioners towards the correct mix of strategies for a given context, avoiding a one-size-fits-all approach. Used together, they allow practitioners to address both individual motivation and structural barriers, thereby increasing reach and sustainability. Where effectiveness is limited, the health belief model assumes rational, informed decision making and has weak predictive power where poverty, addiction, or low health literacy override choice. Beatty's model offers a useful typology but limited practical guidance of implementation, and outcomes are harder to attribute to a single quadrant. The health promotion initiative aims on objective and effectiveness of the Challenge for Life campaign. The Better Health Campaign 2020. Better Health Campaign is a national social marketing campaign launched by Public Health England, now OHID in July 2020, prompted by evidence that excess weight increased the risk of serious illness from COVID-19. It targets adults across England, encouraging weight loss and healthy lifestyle habits through free NHS branded tools and local support services. It aims to reduce adult obesity levels and the associated burden of preventable disease across England, strengthen population reliance to focus health shocks by improving baseline physical health, reduce pressure on the NHS for weight-related conditions such as type 2 diabetes and cardiovascular disease. Specific measures and measurable objectives. Provide a free 12-week digital plan giving diet and activity advice. Use as a flagship. Encourage tools. Local referral pathway. Calorie awareness. Increase public understanding of recommended daily calorie intake, 2,000 calories for women and 2,500 calories for men through mass advertising. Local referral pathway. Connect participants to NHS commissioned weight management service and smoking alcohol support where relevant. 4. Sustain behavior change. Encourage small achievable swaps, activity portion size rather than short-term dieting to support long-term maintenance. Evaluating effectiveness of the initiative. Applying process and outcome evaluation criteria to better health. Reach and environment. The NHS Weight Loss Plan app was downloaded over 1 million times within its first year, showing strong initial uptake. Short-term behavior evaluation data indicates many users reported improved awareness of calories content and modest short-term activity increases. Sustained weight outcome. Adult obesity prevalence in England remained largely unchanged in national survey following launch, with no clear population level reduction attributable to the campaign alone. Equality of impact. Engagement was skewed towards more affluent, digitally engaged users, echoing a recurring pattern in mass media health campaign. The Office for Health Improvement and Disparities to Public Health. The Office for Health Improvement and Disparities, OHID, successor to Public Health England, delivered better health and continues comparable work. Its contribution can be evaluated across 4 functions. Surveillance and evidence. Uses national data, example Health Survey for England, to track obesity trends and target resources to areas of highest need. Policy influence. Evidence from campaigns such as Better Health has informed statutory policy, including restriction of HFSS food advertising and promotion. Health quality focus. Explicit mandate to narrow the gap in healthy life expectancy between the most and least deprived areas of England. Partnership and system leadership. Coordinates the NHS, local authorities and voluntary sector, extending reach beyond any single campaign could achieve alone. A balanced evaluation. Overall judgment. The OHID makes a substantial evidence-based contribution to public health, but its impact is constrained by structural factors outside its direct control. Contributing factors: strong evidence-based and national data infrastructure, convening power across the NHS, local government and schools, rapid ability to mobilize campaign in response to emerging evidence, e.g. COVID-19 obesity risk. Constraining factors: no direct control over food industry pricing and marketing budget. Funding for local public health teams has been reduced in real terms. In 2021, abolition of PHE and restructuring into OHID disrupted institutional continuity. Conclusion: better health achieve strong reach and short-term engagement, but sustained population level with outcome have not clearly improved. Mass media campaign alone rarely resolve complex, structurally driven health issues. The Office for Health Improvement and Disparities broader contribution to public health is evidence-led and well-resourced in expertise, but ultimately bounded by funding, regulatory authorities, and a wider social determinants of health. Thank you.